Hey everybody, welcome to the Big Huntsville Podcast, the show that's all about the people, places, and the stories that make this city an amazing place. I'm your host, Carl Thomas, your favorite realtor, singer-songwriter, and all-around Huntsville cheerleader. Each week, we'll be shining a light on the community heroes who make this city tick, having some fun along the way, and sharing a few real estate tips when you least expect it. So whether you've lived in Huntsville your whole life or you're just thinking about calling Huntsville your new home, you're in the right place. Let's get started. Hey everybody, welcome back to the Big Huntsville Podcast. I'm so excited to be back to doing this. My mother passed away, so it's been a wild couple weeks, a hard couple weeks for me. We were caretaking for her, my dad and I, a whole lot for the last year, and my sister, I have an older sister that lives in another state. So anyways, just being able to be back recording is exciting to me. I'm ready for some normalcy back in life. Today, we have a really cool guest from here in Huntsville. She has done amazing things and is doing amazing things. And based on what I know about her, she'll continue to do amazing things. So we're excited to have her with us today. Her name is Sarita Edwards. Just to give you a quick bio about her before we jump into talking to her, Sarita is the president and CEO of the E.WE Foundation, a nonprofit based in Huntsville supporting families impacted by Trisomy 18, she may correct how I said that, and other rare diseases. With more than 20 years of leadership in healthcare, she's a nationally recognized advocate, licensed minister, which is cool. We've had a couple of those on here. I love just bombing them with wild questions, and award-winning speaker. Her personal journey in faith, loss, and purpose is the driving force behind her mission to change how we support families navigating medical uncertainty with empathy, equity, and empowerment. How about that? Thank you so much, Miss Sarita, for being here. How are you?
I'm doing well. Thank you so much for having me on.
Your smile is, I hope the camera never hits my face. If anybody watches our YouTube, which most people don't, but if you ever watch our YouTube, I like it when the other person, if they have like a booming smile, I like them to be the notice, not me. I probably, every time I see myself, every time I see a celebrity and I think, oh, that celebrity's old, I will look them up and find out they're younger than me. I don't want to see myself anymore. I see myself in my 20s. That's when I see myself. I don't see myself anymore. So anyways, got a great smile. So tell me a little bit of your story, which we heard some of your bio, but what's your personal story? Tell us.
Yeah, thank you for having me.
Yeah.
My personal story with rare diseases started back in 2016. My husband and I, we found out that we were pregnant with our fifth child.
Wow.
A complete surprise. Our eldest kid was headed off to college. The youngest at the time was 7. And
Gosh, yeah.
it was unplanned for sure. And
Wow.
around 22 weeks, we learned that he had a rare condition called Trisomy 18 or Edwards syndrome, just happened to have the same last name as us. And that really changed our pregnancy and just the entire dynamic of our family.
So you found this out before your baby came?
Before he was, yeah.
Wow.
We found out in utero,
Okay.
and having had 4 other children before, and having been pregnant 5 other times because we had actually miscarried once.
Oh, wow.
And so I was familiar with being pregnant and I knew what that journey looked like. And once we got my son's diagnosis, a lot of our the typical prenatal stuff, it changed, it shifted. And around 28 weeks, 29 weeks, I found myself on bed rest. And I had to put a pause in working because I was working full time in the healthcare space. And I found myself on bed rest. And around 30 to 31 weeks, my medical team here locally thought that I needed to transition to a healthcare system outside of the Huntsville-Madison area. They felt like they could provide better care for me there and all the stuff. And so we transitioned around 30, 31 weeks, and then we delivered at that location too. And it was different because I was shocked that they felt Huntsville couldn't not provide care. I later learned that not to be the case. But in that moment, you do what your healthcare team tells you to do
Yeah.
because you're so caught off guard, you don't really know to push back or question. You just follow the plan that's being presented.
Sure.
And at 39 weeks, we were actually induced. And my son Elijah, he was born alive on in March of 2017.
Okay.
And it was a normal, if you will, hospital stay in terms of we were there the same 2, 3 days as with the other children. The difference, however, was that a lot of the normal care that you would receive was not given to us because of his diagnosis. And so we were not given newborn screening. I had to ask for formula to feed him because he couldn't nurse like my other children could. My husband had to ask them to clean him off post delivery because everybody was just standing around waiting to see what was going to happen. And so
Oh, wow.
care was not being provided. And so we started asking for things that we knew to ask for, having done this before. At that time, we did not realize that was advocacy. We thought that we were just parents fighting for their kid.
Yeah.
And we were discharged post delivery in hospice care. My son stayed in hospice care for the first 7 months of his life. And at that 7 month window, I think I just remembered that I had a background in healthcare. And I started questioning things and looking through the medical records that we had. And I wanted to know more. So I started making phone calls myself. I really started treating my son as if he was a patient that I would serve in the healthcare space. And we started connecting with specialists and all the things. And so they told us that we needed to pause because it was going to be a conflict with our insurance if we continue trying to pursue life sustaining measures and he was in hospice care. And so we were like, no, we're going to keep trying to find out what we can about this. And so he was taken out of hospice, which was fine with us. And we started coordinating his care ourselves. We had a really great local pediatrician who was very hands on, very supportive of us wanting to know more. In his 30 plus year career, he had only had one other patient with my son's condition, and that patient died immediately, if I understood him correctly. So for us to be 7 months in, he was all on board with us wanting to talk to specialists and learn more about trisomy 18. And so we continued to coordinate his care. We eventually, grew a medical team of specialists between here in Huntsville and in Birmingham at Children's of Alabama. We built a medical team. And this year, 2025, we celebrated my son's 8th birthday.
Wow. Oh, that's
Yeah.
awesome. That is
Yeah.
awesome. Wow.
Mhm.
Okay, so through this, which by the way, you are no stranger to grief. Uh,
Mhm.
most of a lot of your story is heartbreaking,
Mhm.
but that part is not. That part is
Yeah.
exciting. So you went through this process, you learned a lot as you walked this path, and then how did this nonprofit come into existence?
The nonprofit, the E.WE Foundation, honestly, the goal was to initially provide bereavement support for families because we to get a diagnosis at 22 weeks pregnant and the hope is to make it to 40 weeks, that's a lot of time to think
Yeah.
about, am I going to miscarry? Am I going to lose this
Yeah.
or spontaneous loss, as they called it? Am I going to experience that if he's born? What does that look like in terms of bereavement and funeral? And so those were the questions that I had. And I reached out to our life insurance company, and I knew that Elijah would be covered on our policy the moment he was born. But what I did not know is if they would cover funeral expenses if something were to happen.
Sure.
And so I learned that he would have had to live 6 months in order for them to cover funeral expenses.
Wow.
Well, then that made me reach out to just cold call some other life insurance companies. And I only found one that said generally, if a newborn lives 14 days, we would cover, but nobody covered anything immediate.
Wow.
And so our initial thought was, how can we remove some of the burden of cost for a family who may have to bury their child
Sure.
so soon after being born. And so
Yeah.
that was the initial goal behind starting a foundation. And we knew that a foundation was the best way to do it. We didn't just want to be a family that did it. We wanted to be legitimate. We wanted people to trust donating funds to us to do this and all the stuff. And so that was the start of it. And Elijah kept living. And because he continued to live, he truly is the blueprint of what we do. And so
Sure.
a lot of our work, it turned into, how do you find support? What does peer support even look like? Because that's what we were told by the healthcare space. Find you a support system, find you a support group. But they really didn't help us navigate what that could look like. And
Yeah.
so I was just Googling support groups, Trisomy 18 support groups. And I found some Facebook communities and different things like that, but nothing that spoke to what I felt like I needed in that moment. And because we never wanted to duplicate or reinvent the wheel, we didn't want to take away from services that are already present. We reached out to some organizations that we did find and said, this is what we were looking for. This is what we think is missing. Can we add that to what you're doing? And we either didn't hear back, or people were like, yeah, you're like way over here with your thinking. That's not
Yeah.
something we have the capacity to do. It's not
Sure.
something that we're interested in. So they gave us their blessing. And so we were like, you know what? We're just going to do this thing. And so it really was birthed from looking for specific things ourselves that we weren't finding. And so we thought, why not create it? And here we
Yeah.
are.
So you have become an advocate for these people.
Mhm.
What, I guess the way to word this is, what does that advocacy mean for families that are in this situation?
I think advocacy can mean so many different things. I think it really starts with knowing that even though there's science to support a lot of what we're told about this condition, as an advocate, you can always request something different. You
Yeah.
can you have a right to say, I don't like this solution. Can we talk about an alternative solution for my child? And I think advocacy, in its basic form, is really empowering people to know that you can question the status quo. You can very much say, I get that we were told Elijah needed all of this stuff and that he didn't need all of this stuff. But I feel in my core that if we had done exactly what we were told, we would not have celebrated his 8th birthday. They sent us home with morphine for him
Yeah.
to monitor pain. And as a mom, I'm thinking, for my other typical children, I would snuggle them. I would I would see if they needed a diaper change. I would see if they were hungry. Like, why is the solution for him a dose of morphine?
Yeah.
Because he has a condition with a high mortality rate. And so
Right.
I think advocacy means really just knowing you can question the information that you're being given. You can say, I really don't like this. Can we do something different? Can we just talk about doing something different? And that's one of our goals, to really empower patients and families to know that you always have a voice. Like, this is your care, and you are a stakeholder. You are the primary stakeholder in your care. And so you deserve to be a part of the conversation that determines what that care looks like.
Absolutely. So that was actually one of my questions, was just focusing on that caregiver having that voice. All right, grassroots organizations like yours, your nonprofit, is there ways to take this beyond just family to family? Can you create an impact in legislative spaces? I have it written down, but I can't say it.
Yeah.
Can you create impacts in a broader, bigger way through what you're doing?
Yeah, absolutely. We have our family support. We are a continuing education provider because we wanted to incentivize healthcare professionals, primarily social workers, nurses, case managers. And so we have continuing education learning that's available to them.
That's
In the legislative space, yes, as a grassroots organization, you can make broader impact. We actually speak with members of Congress several times a year,
wow.
talking about bills and different policies that we believe can create better health outcomes for families like ours.
Yeah.
We stand alongside several other organizations. We actually partner with an organization, a national organization that spearheads the event. And they coordinate it to where you can speak with your legislators locally. So I go to offices right here in Huntsville and I have conversations with our legislators and I talk about things that they're working on at the federal level, but I also talk about things that directly impacts the state of Alabama.
Sure.
And so we do that. We've crossed over not only in just the rare disease space, but we've also taken this conversation to education because my son is in the public school system. And when we think about special education and just making sure those are included in these conversations. Sometimes priorities are shifted
Sure.
and the special education departments are not always included in funding and all the different things. And that's awareness that we can bring to those conversations. And so yeah, you can very much stretch yourself as far as you want to. And for me, that meant tapping into every possible spot that I can. If my son is impacted somehow, I try to leverage my voice and be a part of those conversations. Yeah.
That's incredible. You're doing amazing things to help families
Thank
walk
you.
through similar situations. I know that
Mhm.
the bereavement stuff really speaks to me right now because I've just walked through a funeral planning and all of that. And just the average Joe like me is not prepared for that in a
Yeah.
normal situation. So I
Right.
can't imagine a family walking through something like this. It's wonderful that there is groups like yours that would walk alongside them and help them through that situation. Just because I know you're a minister as part of your background, but there is a ministry in that is very special, something that people never forget. The folks that help them in those kind of times. But so
Mhm.
if the public wants to find information about the nonprofit that you do and what you guys are up to, what's your website that they can go check that out?
Our website is the EWE Foundation.org.
Okay, all right. So
Mhm.
the E.WE, right? Is
Yeah.
that what you call it? E.WE?
Iwi, yeah, those are Elijah's initials, Elijah Wayne
Oh,
Edwards. Yeah,
yeah,
yeah.
that makes sense.
Yeah, so that's what he was born with bilateral cleft lip and palate,
Okay,
and my husband was preparing the other children for their first visit to the hospital,
sure.
and because his face was distorted, he looked very different. He didn't want them to be afraid or alarmed, and so he said, "We're gonna call him Iwi. He looks like a cute little Iwi." And so when they walked in, they saw something nurturing versus
Yeah,
something to make them alarmed. Like, why is his face open? We welcomed those questions, but we
sure.
didn't want them to be fearful of their little brother. So
Oh,
that's where E.WE came from. Yeah.
so I've already done a little research on you have a Facebook as well, right? So they can find you on Facebook. They can go to
Yeah.
this website and check out your information. Facebook's probably a good way to follow what you're continuing to do. So if you like what you've heard here, you can jump on Facebook, click follow, and then keep up with what's going on in their ministry. I'm not even going to call it nonprofit, in their ministry. So let me ask you this. Do you have anything coming up that I can help you promote on here? That's what I really want to do.
Oh my goodness. We just wrapped up our annual Leap Summit, which was fantastic. It was an opportunity to just raise awareness, and we will have a replay up on our YouTube. I know, like you said, it doesn't always get a ton of traction, but if there's a learning opportunity, people may
Yes.
find value in it. That will be uploaded on our YouTube, hopefully within the next week or two.
Awesome.
But I think one thing that we're really crossing over into is really trying to expand leadership. I have a lot of organizations reach out to me, and whether it's to speak or it's to help them navigate getting started, like how did you do this? And we're crafting some leadership things that we're trying to put some things together to just better help other organizations. You don't have to be a rare disease organization. A lot of our information honestly is open to everybody. We only have one program that's exclusive to Trisomy 18, and that's our financial assistance program.
Okay.
But every other program that's on our website is available to anybody. We want people to find value in our resources. A lot of our stuff is absolutely free. We don't charge for anything. We are strictly donor based. We do a lot of grant writing and sponsorships and different things like that. We haven't found ourselves wanting to charge people for things. Yeah, so our leadership series, it will be available to anybody. It's really just going to be helping you build your leadership if you are a nonprofit leader and you want to grow your organization. That's one thing that we hear a lot, how fast we grew. We want to just help people figure out what that can look like for them.
That's awesome. Hey,
And
part of my
so,
goal on having this podcast is to connect and
yeah,
to find all of these nonprofits in our city that are doing
yeah,
great things to make this a better place, and to walk alongside them and help them publish what they're doing and make sure the world knows about it. So it's
yeah,
really good to know that there's someone out there who knows that it is not only hard to start a 501c3 nonprofit, but it is hard to scale one. To know how to
yeah,
scale is difficult. So it's great to know somebody's out there that might be able to join alongside you and give you some tips. So that's
yeah,
awesome. Good,
yeah,
good.
yeah, yeah.
And you're no stranger to the podcast world either, right?
No, I'm not. I'm not. We've got a little tiny podcast we put
All
out.
right.
Yeah.
Tell us about it. What is it?
So our podcast is the Being Rare podcast. We really highlight conversations from families navigating rare conditions. We also talk to organizations to highlight the work that we're doing. It's really just a space for people to get information. You can hear stories, but you can also hear impact. We're very honest about the disparities of care that exist in the rare disease community. A lot of families have symptoms, but they don't have diagnosis, and the challenges that come with that. So we try to highlight patient and family stories and what that impact looks for them. But then we also want to celebrate the organizations that are trying to serve them. So that's all the stuff that we talk about on the
That's
podcast.
fantastic. I love it. I love it. And then you have a new leadership series that you just went over. So what is that
Yeah.
series called again?
We actually don't have a name for it yet.
Okay. All right.
It's completely brand new, and it's birthed from just getting requests from people. They just want you, hey, can you take a look at this for me? What are your thoughts on this? And so it's really just being birthed from trying to be a resource and a support to organizations. But then, too, one thing that we have also found, too, Carl, is that a lot of families want to do our leadership series. A lot of families, they want the continued education. They, I don't, for them, it's not about needing it for my job or for my
Sure.
license. It's about showcasing that I'm putting in the work to learn more about
Yeah.
advocacy and how to be a good advocate for my child. And even if they don't need it for their employer or for license renewal, we give our CEUs to moms and dads who
That's
just want to
awesome.
learn. Those services are also available to them absolutely free. And so, yeah, we don't have an official name for it yet.
Okay. All right.
It is a new project, but it's in the works. Yeah.
Well, once again, press follow and check out the website and keep up with what they got going on. And I'm sure that name will pop out soon so that you can get involved in some of these things. And if you want to support them financially, I know that you can reach out through the website, the ewefoundation.org, through the Facebook page. What's the Facebook page name? Same name?
It's Facebook. What is it? Facebook.com and then slash it's everyone is we.
There you go.
So
Everyone is we. Okay. Yeah.
everyone is we because we're all in this together. So everyone is E.WE. Everyone is
Awesome.
we.
Okay, love it, love it. Thank you so much, Ms. Sarita, for being with me today and for talking to us. Very unique, very cool that you're here doing this, making this city a better place, making it an easier place to live for the people
Yeah.
who are walking through these type of things. That's awesome.
Mhm.
Well, everybody, definitely go support them. Definitely check out what she's doing. She is a licensed minister as well. We didn't even get to get into that today, but definitely follow the path that they're headed down so that you can keep up with this unique, awesome ministry. I'm going to call it that again, that they're into. Thank y'all for being with us. We always look for people doing big things in the Huntsville area, and we definitely found one today. I'm very proud of being able to share what she's up to. So y'all catch us next time. We'll see you then. Thanks for tuning in to the Big Huntsville Podcast. If you've enjoyed the stories, the laughs, and maybe learned a little something new about our amazing city, remember, Huntsville isn't just a place, it's a community. And we've got some of the best folks around. So if you like today's episode, please don't forget to subscribe and share it with a friend. And if you got a local hero or story you think we should highlight, hit me up. I'd love to hear about it. Until next time, I'm Carl Thomas. Keeping it fun, keeping it real, and always keeping it big here in Huntsville. Catch you later.